Okay. Great. Can you guys see my screen now? The slides? No? Oh, okay.
Yeah.
It was up there before, but now it's gone.
Okay, let me.
There we go.
Okay, great. So I think I'm both recording and sharing things at the same time. Excellent. I've got all my boxes. So thank you guys for joining me tonight. I'll say this more for the recording, but if you don't know who I am and or about the work that I've been doing, please go back and watch the part 1 of the New York Health Act for birth workers, because I spend a lot of time explaining kind of how I ended up hosting these teach-ins and what we're trying to do here. But I'm a nurse and a trained midwife, a doula, and an activist who's been pretty involved in the birth world in New York. And I'm also an ardent single payer healthcare supporter and supporter of the New York Health Act. And so these teach-ins, I put together these teach-ins because in supporting the New York Health Act, I realized, there are things in this bill that we could improve for birthing people. So beyond advocating that folks should pass it, let's work with the legislators who are proponents of this bill to really sharpen this and make it as good as possible for birthing people. So once it passes, we are set up for success. So tonight, so in the first part of the teach-ins, I explain a lot about who I am, why the New York Health Act is important, why we need single payer or universal guaranteed healthcare for reproductive justice and for birth justice. And so tonight we'll be talking a lot more about like the specifics of the bill and what language we can actually change to improve it for birthing people. And we'll end with a quick legislative update of kind of where we stand with the New York Health Act now after the November 3rd elections. So just generally, the New York Health Act is a state level bill that would implement a universal guaranteed healthcare system or a Medicare-for-All healthcare system at the state level in New York. And for the last 2 years, we've been only one vote short, or like really only one senator short of having the majority of support that we need to pass the bill in the legislature. And essentially, I'll talk about this more at the end, but the TLDR is we're still waiting for the vote counts to come back on 3 or 4 senators that will kind of make the difference of whether we have more than enough votes to pass it January 1st, like as soon as session starts, assuming everybody who used to co-sponsor it is going to continue to co-sponsor it, versus if we still don't have the support and need to be putting pressure on Democrats who've never openly supported the New York Health Act. So the New York Health Act will cover everybody who lives in New York and anyone who lives outside of the state but works in New York. And so there are no barriers based off of employment status, health status, pre-existing conditions aren't a thing anymore. And essentially, like the law isn't super specific, but I think it's as easy as like you show a bill with your name on it, or like any of the normal avenues that exist to demonstrate residency for services. As far as what does it cover, generally, like as far as health, we'll talk more specifically about like things very specific to the birth world, but generally it covers everything. Primary care, preventive care, inpatient and outpatient hospital care, prescription drugs, which is a huge thing. All prescription drugs would be free. All dental and vision care would be free because teeth aren't luxury bones. So we should be able to like get healthcare for our mouths and not have that separated out. Long-term care and support services will be free, which is which will be revolutionary for folks with disabilities and folks with chronic diseases. And there will be free choice of provider because all providers in New York will have to take the New York Health Act and essentially, like if they're practicing medicine or if they're practicing under their health license in New York, it's going to be because they accept the this reimbursement or no reimbursement at all. So how do we pay for the New York Health Act? Through taxes, the way we should be paying for a healthcare system. So the taxes taxes that will pay for the New York Health Act are not written into law, like are not written inside of the New York Health Act. Essentially, the act says that the trust, like the board of trustees that it establishes, will have to come up with a tax schedule within the first 2 years. So that's to say this graph I'm showing you now is not set in stone of like how much taxes everyone will be paying, but this is one of the tax models that's been used in studies to kind of a tax model that's been used in studies that would sufficiently cover the costs, the projected costs of providing healthcare for everybody in New York State. And what you can see is you don't even start paying taxes till you've made $25,000 a year. If you're employed, like if you work for somebody else, if you're making $50,000 a year, it's $900 a year for health insurance. So way less than anybody is paying for their health insurance premiums through work. And then even like, I think $4,500 is a lot of money to spend if you're self-employed and only making $50,000, but also it's still probably less than what you're currently spending on health insurance through the private market if you're making that much money. And it's certainly less than you'd be spending with copays and deductibles if you actually need to utilize the health system. And like I said, this is subject to activist pressure. So if we all agree that $4,500 is too much for somebody who's self-employed making $50,000, we can tell the legislators that and ask and kind of push and give our preferences of how to schedule the taxes so that they're equitable and fair. So just generally, the New York Health Act would take our current healthcare system where healthcare is paid by like this crazy flow of some from out of pocket and some from your employer and some from the government and some from nonprofits and da-da-da-da-da. And this says, nope, we're all just going to pay taxes according to our ability to pay taxes, according to how much money we make. And from that pool of money, all health expenditures get made. And that way how much you contribute to the health system is tagged to how much you're able to contribute to the health system and not tagged to how sick you are. Because essentially how it works now, who's paying more for healthcare are people who need to utilize those services more frequently. And so like the bulk of the bulk of money going into the system is coming from sick people who probably can afford least to be spending that much money on their health care. Here we make it equitable and pin it to your ability to pay and to your income. So this is these are essentially every study you read about will the New York Health Act save us money or not, there's so many factors to incorporate in there that it's essentially it's like if you change any one of those factors, whether or not it saves us money and how much money it saves us changes. But the general projection is essentially we're going to be able to cover more people and spend less because we're going to be putting all of our money actually into patient care instead of a huge portion of our money into administrative services that don't really benefit anybody. So that's kind of like the general overview. I'll pause here. Any questions or clarifications on things we've said so far?
I have a question.
Yeah.
A few slides back, when there was a slide describing what's covered under the Health Act, it listed support services. Would doulas fall under that category, or those clinical providers?
I believe so. Generally, the New York Health Act covers if it's currently covered under Medicaid and Medicare, the New York Health Act will cover it. So when it comes to doulas, that's a huge question mark in New York State, because for those of you out of the loop, there, like a year ago, they started 2 doula pilot programs through Medicaid. And I guess, like, I don't know even if the pilot program means that it counts and like doula services are in, or if the pilot program, but more, so like it's a little bit of a question mark, but I'll speak more generally to like how do we make sure things like that are covered in a couple of slides down. Any other questions here? Cool. So let me just put the thing there. Okay, so here's some technical parts of the bill to explain kind of like that we need to understand like how it exists now for it to make sense, how I think like what the recommendations are and how we can improve it. So essentially what the New York Health Act does is it establishes a board of trustees that going forward, all of the main decisions about the healthcare in New York will be made by the commissioner, like by this board of trustees and the commissioner who leads it. And so in the text of the law, it describes like who gets a seat on this board. So there's a commissioner, there's a commissioner, 29 trustees appointed by the governor, 6 of whom shall be representatives of healthcare consumer advocacy organizations, which have a statewide or regional constituency. So like a doula organization could be considered a organization that represents a healthcare consumer advocacy organization, if we are actually doing that type of work and positioning ourselves in that way to be appointed to the board through that means. And then the long story short is like there's 2 seats for doctors, there's 2 seats for all non-medical health related professions. So one of the main recommendations that I've come up with is that we should ask for more seats, like for 2 seats set aside to represent nursing and for a seat set aside to represent midwifery. And that way, you know, like the bill doesn't say like, and we're going to cover dialysis care for this much per treatment, and we're going to cover doula, or we are or are not going to cover doula care, and we're going to cover it for this much. The bill doesn't like get that specific about any particular like care delivery issue. What it does is establish this board that going forward would make all of those kinds of decisions. So I think the way we make sure that the needs of birthing people are represented is by making sure we get seats at this table. And we get seats at this table, I think, by writing into the law extra seats for us. So the board of trustees is like the central board at that will make like the central statewide board that makes decisions for everybody, and then the information and decisions that the central board will get will be informed by decisions and conversations that are happening at regional levels. So essentially the same board that exists on a state level exists at a regional level for each of the boroughs in New York City. And then like they're, you know, if you're curious, you can read the groupings here, but essentially Long Island, Central New York, North New York, Central New York, Western. And on each of those boards, again, on like each of the regional advisory councils, they have seats set aside for doctors, seats set aside for health consumer advocates, and at the regional board, they do have a seat set aside currently for a women's health expert. So we could, you know, we could use that seat to put someone forward from the reproductive justice world. But again, another recommendation is just going to be to get us more seats at that table. So that way, you know, if we have a strong advocate, a midwifery advocate for us on the regional boards and at the state board, then I think we're really setting ourselves up for success and put ourselves in a position to really get what we need out of our health insurance, because in the same way, you know, like the midwife on the board is gonna like listen to the recommendations coming from the disabled community, because they know what's, you know, like they know what those needs are, and the midwife is going to be incentivized to listen and act cooperatively with folks representing other communities. I think in the same way, if the midwifery seat says we need XYZ, the folks from other communities are gonna be like, oh, dope, we'll do that. Like the general sense is this should be collaborative and like really for the best interests of the people. So I think like if we have our eyes open, and if we're like, if as a birth community we're paying attention to who holds those seats, we could have a lot of influence that way. So some other technical things to understand about the bill is how is reimbursement going to be determined? So a really cool thing about the New York Health Act is it says that there may be a variety of different payment methodologies, including those based on demonstration basis. So that what essentially that means is if we can demonstrate that paying X amount of money leads to good outcomes, then we can get that much money reimbursement for the service that we're requesting it for. So like if, let's say the doula compensation comes through, but at its current level, like as pilot programs, if we demonstrate like a clear benefit through the doula pilot program, we could like make you know, on paper case, so this is what our reimbursement should be. And then generally how those decisions get made is through collective bargaining. So like all of the midwives get together and say, this is what we need, and we submit it to the board, and we go back and forth with the board. And pretty much every tool available to us as providers, we have to organize and you know, demand equitable reimbursement. Every tool beyond, or every tool up until striking, but also like our like striking as healthcare workers. That's, you know, even I would, does it, yeah. So that's a different debate of whether you think healthcare workers should have the right to strike. But the bill, like we're allowed to organize, we can get our patients, you know, we can organize our patients and have our patients be a part of the folks who are demanding that we get reimbursed in a way that actually lets us provide care well and patient-centered and with a low enough patient load to really focus on the birthing person in front of us. And then lastly, on the technical notes, I think something important for us to understand is that the New York Health Act will be payment in full for all services. And so essentially, like if you are a provider that takes the New York Health Act and receives reimbursement from them, you cannot charge above and beyond whatever you receive for reimbursement. And so I bring that up, and I think that's especially important for home birth in New York, because essentially every home birth midwife I know in New York is charging beyond what reimbursement, beyond what insurance reimburses, because insurance companies aren't reimbursing at a rate that's sustainable for home birth midwives. So like I get like one reason why it's super important that we have a seat at the table in deciding and making these decisions is that if the home birth will be covered under the New York Health Act because it's covered under Medicaid, but the Medicaid reimbursement is like $2,000, like and midwives need like 10 to 11 to really function as they currently, you know, to meet the current model of care for home birth in New York. And essentially what home birth midwives say is like, you know, we'll set you up with our biller will do everything possible to get as much reimbursement possible from your insurance company, but anything short of X amount of dollars, you're going to have to make up for out of pocket. So when the New York Health Act passes, I think it's either going to be all or nothing with home birth. Like either it's going to be reimbursed fairly, and now anybody in the state who wants a home birth can have one and not have to worry about any out of pocket expenses, or it's not going to be reimbursed fairly, and essentially the only people who have access to home birth are people who can pay the whole cost out of pocket, because midwives won't be able to do the split billing that we're currently doing. So if you're looking around and thinking, there are no home birth midwives in this Zoom, I know I've been working really hard to try and get them to try and put this on the radar and try and say like, hey, this is a huge thing that could pass in January and really put us up a creek without a paddle unless we're prepared. And I think, again, like back to the oppression, the common oppression we're all facing, like the home birth midwives are busy and trying to juggle a lot of things, and this is maybe on their periphery. But if you have a relationship with a home birth midwife in your life, please tell them it's important that they be paying attention to the New York Health Act, and we need their we need their signature on the recommendations we come up with, because this is going to be somewhat make or break. So as far then like some other cool things that like we could do with the New York Health Act, or like the potential under the New York Health Act if we're well organized and if we know how to put pressure, or like what to ask of the midwife who's representing us on the board. The New York Health Act offers, or like from the trust fund where all the money, like all the taxes get paid into, the trust fund, we're allowed to take money from the trust fund to go to medical education. So one of our recommendations will be that it will also be able to go towards midwifery education. And in doing so, hopefully we essentially can open more midwifery schools and pay for the new midwifery schools, or at least the clinical education aspect of those new midwifery schools, out of the New York Health Act instead of out of the pockets of people who want to become midwives. Isn't that cool? That would make it super more accessible to become a midwife. Also, the program may provide in payment methodologies for a payment of capital-related expenses for specifically identified capital expenditures incurred by not-for-profit government entities certified under. Okay, so long story short of what this essentially says, that like if you need to build a new clinic, a new hospital, buy a new MRI machine, if you prove that like you actually need that piece of equipment or that institution, and that that's a need for the community, then the New York Health Act will pay for it out of pocket. Think what this could mean for birth centers in New York. Like, we make the case that, hey, there's no birth center in the Bronx, and there should be, and that should be an option. What's a huge capital, like the biggest barrier in starting a birth center is the capital expense of the building where the birth center is located. So passing the New York Health Act, essentially we are creating a legal avenue for public financing of birth centers or any other kind of reproductive health and wellness centers that we can prove there's a community need for. Wouldn't that be cool? And lastly, Charlie, as you were saying, like, will doula reimbursement be covered under this? I think it kind of like, generally, if we can prove that it helps people, we can get it covered under the New York Health Act. Because like the language of the law is essentially like, this pays for anything that promotes the health of New Yorkers. If we can make the case that having a doula compensation or a labor support stipend improves the health of New Yorkers, then we can get it approved So I think it is a lot of, kind of puts it back on us as a community of like, are we organized enough to make those demands of the health insurance going forward? Because there's definitely avenues that are created by the New York Health Act if it doesn't, institute doula reimbursement explicitly upon its being passed. Does that make sense? Thoughts, comments, questions, concerns?
Does that like de facto mean that we're gonna have to go over this argument again of like certification of doulas by the state, or? Yeah.
So I think that depends on the avenue we choose to take in. It depends on what we're asking for. So if we want doula reimbursement, then I think it would be very difficult to get doula reimbursement without some kind of certification process to say who and who is not a doula and who does not qualify for reimbursement. Now, so so my instinct as an activist and as an organizer is to not ask for doula reimbursement, but to instead ask for a labor support stipend, which would essentially be like, what if the New York Health Fund wrote every birthing person a check for $2,000 at 36 weeks and mailed it to you, and you could spend it how you wanted on your labor support team. So so if you want to hire a doula, awesome, you can hire a doula and vet their certifications and their training to your, to how you feel comfortable, and you do your own vetting of how that doula is prepared. And if you don't want a doula and you want your best friend to be with you, but she otherwise wouldn't be able to because she's working, and can't take off from work, oh, well, now you can be like, hey, here's $1,000. Can you take a couple days off from work so you can be with me in the hospital? And, here's $1,000 to cover the work. And here's, I have enough money also from the stipend so you can take childbirth ed classes with me so you know what's going on. So I think if we take a support stipend route, then we don't have to worry about certification because we put the power in the consumer's hand to decide like who they would or would not want support from. And I'll just say generally as a reproductive justice advocate, like I think support stipends are the better direction to head in, because of the first client I had with when I was a volunteer doula with Ancient Song, she was alone in the hospital and her husband was driving a cab all day. And it was I got an email like, there's somebody in the hospital today. Is anyone available to go and be with them? And I responded and went to the hospital and was with her. But like, when I heard that her husband was driving a cab, I was like, could I go drive the cab for him? And so he can be here with you? Yeah, I have all this labor training, but like, she had an epidural. She was pretty comfortable. Really, she just needed company. And I just felt dumb that my time for being there, if everyone was being reimbursed equitably, wasn't worth any more than his time driving the cab. So it would have been better to just give that family the resources to have the actual support that they would have wanted instead of just what's out there to be had. So I think support stipends help, avoid all of avoid a lot of inequitable issues that come up with who can get certified as a doula, what makes you certified, what should the certification requirements be, not be. So labor support stipend is probably a more radical political idea and probably is harder to get passed legislatively than doula reimbursement, because people are like, oh, what if they spend the money, because people don't trust their neighbors to spend money appropriately. But
I know that does exist in other countries though. Like in France, they have a thing with their health insurance where every trimester of pregnancy you receive a stipend. Other possible models to go off of there.
Exactly. So I think an advantage under the New York Health Act is that it makes it a lot more feasible to arrive at something like the labor support stipend, because we could do it essentially by making our case to other healthcare professionals with data instead of politically through its own bill. But that all said, and for folks who watch the recording, if you want to write a labor support stipend bill that taxes the rich in some unique way and then sets that money aside for labor support, come write that bill with me. It's essentially the missing link in reproductive justice legislation is there's not a lot of people writing it. There are lots of people who are looking for reproductive justice legislation that exists so that they can support it. And if you are one of those people thinking oh, but why can't I find any RJ legislation out there to support? It's because there's not that many people who are actually typing into a document what the law should be and how it would all work out. So I'm very interested in doing labor support stipends, and it's just a capacity issue at this point that I'm choosing to focus on the New York Health Act. If you'd like to do that, please get in touch. Any other questions about with the things we've talked about so far, what's possible?
Does one need legal experience as a lawyer to write a bill, or can bills be written in like regular non-legalese language?
So I don't know. I just typed into a Word document like my first attempt at a bill last week. So I'll let you know as I find out. So essentially, no, you definitely don't have to be a lawyer because I started without any formal law training. I think like essentially how I knew to write that bill is because I've been reading a lot of bills. Like I read the New York Health Act a couple of times. I've read a lot of the tax the rich bills, the reparations bills. So like I've just been paying attention to like, okay, I see what they want to do generally, and this is how they're phrasing it, and these are like the institutions they're calling on, and like the frameworks they're using to make that into an actual law. Oh, so this is how we could do it for this other thing. And as far as I know, that's all you really need is an idea of a bill, and then as like what changes between its current iteration as a rough draft in my Google Docs to like an actual bill will be a lot of conversations with legislators who essentially like, this is the idea, we'd love for you to sponsor it, and they're going to say, okay, I'd love to sponsor it, but this, that, and the other thing needs to be changed, or like we need to tighten up the wording on these things. So my hope is that I'll learn as I go, and that we'll learn as we go. Like we come up with essentially what we want, and then we work with legislators who are allied to us and who, who have proven that they are really working in the interests of the people, and we work with them to hammer out the specifics of like the legalese of the law. So here are the recommendations I came up with to improve the New York Health Act. So let me just go through. So I'll just go through them one by one. This first one is, this section of the bill says that all prescription drugs will be covered, and all non-prescription smoking cessation devices will be covered. And I thought, oh, well, if we're covering smoking cessation devices, we should be covering contraception too. So I just put add non-prescription contraceptive products or devices. Let's see, then this is the recommendations for the Board of Trustees. So essentially the recommendation is, instead of 29 trustees, let's have 32, 1 who'll represent midwives and 2 who represent nursing, and then the 2 non-medical health positions that currently exist, those can go to like occupational therapists, physical therapists. They can share those 2 seats instead of like all nursing and therapists and everyone sharing those seats. The bill as currently written says that folks who serve on the boards, both at the state and regional level, won't get paid for their work on the board. And I don't think like that's not equitable. Like folks from the most affected communities can't afford to work for free generally. One recommendation is to strike the part where it says they will not serve without compensation, and instead say trustees shall receive fair compensation for their time and be reimbursed for their necessary and actual expenses while being engaged with the business of the board. This recommendation it just like lists the types of places that can be reimbursed: clinics, hospitals, whatever. So I put add birth centers, because let's just be clear from the get-go that birth centers are included, and that way we don't have to worry later on if like they're counted under a designation of a clinic or whatever. This is where it said the New York Health Act will pay for medical education. So let's also have it pay for midwifery and nursing education. No reason for it to only pay for the predominantly male profession in healthcare. Again, add birth centers. This is just another list of who can be reimbursed. This section of the bill says like any major changes in health need to be signed off of by the commissioner for people with disabilities, the commissioner for the aging, the commissioner for commissioners of several community interest groups. And so, but none of the commissioners listed explicitly cover like gender equity related issues. And when I looked, essentially the only office at a state level that would handle something like that is the Division of Human Rights. So I said add the commissioner of the Division of Human Rights, that they would have to sign off on any like major fundamental changes to how the program is administered. This is like something super technical. It's like, it's if you qualify for Medicaid, then to be able to get the federal funding that Washington, D.C. sends to Albany to count towards your care under the New York Health Act, you may have to sign some waivers. And if you don't sign those waivers, eventually you get kicked off of the New York Health Act. So I just said like, okay, so when you do sign those waivers, you get put back on the New York Health Act. So like if you're traveling and you miss them, you like, just to make sure it's easy to get back on. This is for regional boards, like who has seats on regional boards, and they did have someone for women's health, but not for not anyone representing nurses, which is by far the largest healthcare profession. So I said, let's put some seats on there for nurses. And lastly is just, again, with the compensation, that folks who serve on the regional boards, just like folks who serve on the main board, should be compensated for their time. So essentially, like, given those recommendations, now what next? So a little background behind the bill is that we've been able to pass a bill, you have to pass it out of the Assembly and out of the Senate. The Assembly has always been much more Democratic than the state Senate has, and the New York Health Act has passed from the state Assembly multiple years in a row. And it's always been getting it passed out of the Senate that has posed a challenge to us. In 2018, we finally took a Democratic majority of the Senate. So we had 40 Democratic state senators, and 31 of them were co-sponsors of the New York Health Act. So like I mentioned before, there were, if all of the co-sponsors had kept their seat and we won one more seat of pro New York Health Act people, then we would have all the co-sponsors we need to bring this bill up for a vote first thing in the session. And we don't know if that's happened yet, because we're still counting votes for Pete Harkim and Jen Metzger's races. And that essentially, like, these two people will make the difference between having one more vote than we need or one too few votes. Again, if everyone who used to co-sponsor the bill signs up again as a co-sponsor, and I say that a couple of times, mostly because of this guy right here, Kevin Thomas, who's a senator out in Long Island, because it's been rumored within the activist community that he has pretty cold feet, and that, like, if it looks like it may actually pass, he may withdraw his support. So now that we're down to like only being one or two senators away, like it's a bit of a game. So that said, and here's a New York Times article about why counting the votes has been so slow in New York. So kind of two potential futures is, one is we keep all of our seats. Unfortunately, only one of these guys won his race, Jeremy Cooney. But it's still theoretically possible that, like, we have all of the co-sponsors we need. Everybody's, activists reach out to everyone in the next couple of months. People all commit before the session starts that they're going to be co-sponsors of it. We know going into January, we have enough votes to pass it. We start putting pressure on the leader of the state Senate and of the Assembly to call the New York Health Act for a vote. It gets voted on in the first couple of weeks of the session in January. It passes, and then there's a 2-year-long implementation phase between when it passes and when everyone will be, like, using a New York Health Plan insurance card. And then and in that scenario, the recommendations that we give to legislators to improve the New York Health Act for birthing people really need to be submitted as soon as possible in like essentially the first week of December. So that way they have time to like make it into legalese, incorporate it into the text of the law, and be ready to go as like, you know, fully incorporated amendments if it gets voted on to be passed when the session starts. And if the session doesn't start, so what I'm hoping happens is essentially next week, I let me send you this Win is Good. I have a Win is Good out there, like the free version of Doodle now. So I'm asking for folks to tell me when they're available, and hopefully next week we'll meet, and essentially I'll meet with as many people as want to give input, because as you were hearing me say all these recommendations and you're like, free birth control, but what about free something else that Katie hasn't thought of yet? I want to hear those ideas. I think the best, so I want to hear other folks' ideas. I hope other folks will take the time to read the bill. It's 28 pages, so it's longer than most, but not a book. Like, you could get through it in an afternoon. See what pops out to you. See if you are, see what pops out to you. See if you're reading like, oh, we could put, does that mean this thing? Because the answer may be yes. Now that we've realized it could mean that, and if we know to be asking for it, we definitely could. So the goal is next week we meet in working groups and kind of finalize these recommendations, so that the week after that we can meet with Assemblymember Gottfried and submit them to him, and then like the first 2 weeks of December work, go back and forth with Gottfried's office, and hopefully by the end of December we'll have our recommendations in. And then as far as like inclusion, exclusion in this process, like if you're wondering like, oh, it seems, why is Katie cutting it so late to the deadline of when we need to submit recommendations? I mean, to be honest, because I was waiting for more birth organizations who are established in New York to get involved and to help me with this process. And it kind of was like, wasn't until, I kind of had to be like, if I wait, this won't happen. Just put the teach-ins out there. Like, let's just get what the recommendations we have. Like, I think the recommendations I came up with are better than nothing, and will like make it a lot better than it would be with, than it would be otherwise. And so I think, so my perspective is essentially like, any recommendations we can get in this year, awesome. And if people have recommendations that didn't get submitted in time, and or feel excluded from the process, no worries, because we can, if it doesn't pass, then we'll keep working on this and make recommendations to submit for the coming years. And if it does pass, then cool, let's get involved with the activists who work on it, and let's talk with our legislators about how we, what we do now that it already has passed. That's essentially to say anyone who wants to be included is included, and please let your friends know that we're doing this process. Like, if somebody is not involved in giving the recommendations, like I essentially want to absolve myself from the responsibility of soliciting individual people's like input on the recommendations, because like if I'm deciding whose input we need, like that's not democratic either. I'm doing as good as I can to get the word out there. Help me get the word out there. We'll do what we can with what we have. And if folks feel excluded, just get involved, and then you won't be excluded anymore, and your voice will be included with whatever we work on going forward. So will the recommendations that we submit actually be incorporated? I can't say. I've never tried to do this before. I know that Assemblymember Gottfried, these two legislators, Gottfried and Rivera, they both know who I am. They've both seen me testify before. They both follow me on Twitter. I think, they've been generally supportive of like, their general stance has been like, tell us what we can do to be making things better. So I think it's very likely that most of those recommendations were pretty straightforward, don't cost any people, most of them don't cost anybody money. So hopefully they will be incorporated and they'll listen to us and make a meeting. But it also kind of depends on us, and if it's just me that's reaching out to Gottfried, then like why should Gottfried work with just me? But if there's lots of us who've been working on this together, and if the recommendations we come up with have a lot of folks signing off on it, Gottfried has worked in the past with various birth professional groups on legislation. No reason to think he wouldn't work with us on this if he sees that it is generally the consensus from the community. And that is to say, the more involved we are in helping get the New York Health Act passed generally, and the more we are involved in the overall advocacy efforts, the more visible we are to those legislators, and the more say we'll have in shaping it as it's passed and after it's passed. So would you help pass the New York Health Act? Stay in touch with me so that I write blog posts and send them out with the fun ideas of how to get involved with New York health advocacy. Follow your local DSA. They are doing a lot of great on-the-ground organizing, particularly in the districts of Democratic holdouts, to put pressure on those holdouts to come out and support. Follow the Campaign for New York Health, the central campaign, and make sure you're getting emails from them so you are in touch with what's happening at the central campaign. And then for folks who aren't already organizing with me in an ongoing way, come organize with me in an ongoing way. Every Wednesday at 2, but I think it's going to be 3 next week going forward. Anyway, every Wednesday afternoon at a time to be determined, I have a general Zoom. So you sign on and I chat with folks, get a sense of who they are, where they're coming from, what they're interested in. I share kind of the different projects I've been working on, what's been going on with the reproductive justice activism generally in New York City. And we think about ways to collaborate together. So the best, if I don't already have your information in my database, please make sure you fill out this form. And then also, just to reiterate, please fill out the When is Good, so you can be in the working groups to chat about recommendations next week. And that's all I have to say. Thoughts, questions, comments, concerns? I'll stop this share.
I have a question. So inevitably there's definitely going to be voices that are left out in this process and ideas that people have about changes that should happen to the bill before it's pushed through the Senate. So I guess let's assume that if the bill does follow this schedule and best case scenario, it passes through the Senate and everything, and we get our recommendations in, what is the process for making amendments to this structure? And after it passes, will that have to go through the advisory boards as opposed to more legislation through another bill process? Or
I think so is the, I don't know / I think so, I think is the best answer, which is to say I'm not exactly sure of how we would make changes after the bill gets passed, beyond going through the regional advisory councils and the state board of trustee to ask for something to be included, excluded. Obviously we could, I'm pretty sure laws are always subject to change by future laws. So we could always write a small, in addition to the New York Health Act, Bill XYZ32, this bill hereby establishes an extra seat on the Board of Trustees for the New York Health Act to represent the interests of X community that we forgot before. And going forward, it will be 33 seats instead of 32 seats. So I'm pretty sure that like that option will always be available to us of like putting into bill form the change we want to see in the New York Health Act. It will just be a lot of extra work. So which is to say, well, for all the reason for us to, to get them in now, and also all the reason for us to keep organizing and learn how to write bills, because obviously they're going to, even those of us in the Zoom may realize something in a couple of months from now to how to improve it after it passes, and so we'll just write a bill then. Anything else?
I have a question.
Yeah.
Have you reached out to advocacy groups like March of Dimes or other groups who do women's health or birthing advocacy in New York State and gotten pushback on these issues, or is it just that they haven't been receptive to taking them on?
It is, I think, much more the latter than the former, and much more of a capacity issue of there's this issue going on. It'd be great if you guys did XYZ, and they're like, if you do XYZ, I'll sign off and say that I support it, but we don't currently have the people available to be doing things like that.
Sure.
So as far as which organizations there aren't a lot of nursing organizations with a strong presence, specific to infant maternal health. Bite my tongue if I say there aren't strong nursing organizations, because the main organization working on the New York Health Act is the New York State Nurses Association. But there's not it's not AWON or NAN, like the women's health nurses or the neonatal nurses. They don't really have any local presence. And then most of my disappointment would be around the midwives in New York, because I've been personally involved in the midwifery organizations for a long time as a student and as a midwife. I've made lots of announcements. I've talked to lots of people who've been involved on their organizing committees. And there's just not a lot of capacity within the organization to focus on policy things. And apparently not a lot of willingness to work with folks outside of the organization, who are working in similar pathways. So
that makes sense.
But if March of Dimes is one of I emailed them, and they took a month to email me back, and then I was in a different place and I didn't follow up with them. But if anyone has contacts at the March of Dimes, I'd love to be in touch with them and chat.
Yeah, we can talk about that, definitely.
What about some of the nurses unions? Because I know there's a couple locally as well.
So the New York State Nurses Association, NYSNA, the campaign for New York Health, the central campaign, is directed by Katie Robbins, and she is on NYSNA's payroll. So essentially NYSNA pays one of the only organizers who focuses on the New York Health Act full time is on NYSNA's payroll. Essentially, the other organizers who work on the New York Health Act a lot, but aren't the official campaign directors for the New York Health Act, are usually paid through the Physicians for National Health program. So those are the two main, I think PNHP and NYSNA are the two main organizations really putting time and money behind getting the New York Health Act passed. And beyond that, I haven't seen a lot of participation from healthcare organizations beyond just individual members. So I've seen people who said I'm a member of XYZ nursing union, but it's not the leadership from unions that aren't NYSNA have been strong in support. Does that does that track with folks' general understanding? I'm looking at Tess. I think you have a good background in the New York Health Act. And then as far as the doula organizations, I'm in touch with most of the doula trainers. A lot of them were here for the first part when I think at least birthday presents. Jada Shapiro emailed me and said, like, I have to miss this, but I'll be watching it and be at the working groups. So, you know, the dual organizations, again, are generally supportive and just lack capacity. Like, none of the dual organizations have a policy person or have, you know, people on the payroll with whose time, like, has time set aside for working on policy things. So most of them are helping like as they can as individuals, and I will hopefully have their sign-ons for the like most of the major dual organizations when we come out with the recommendations. Any other questions, thoughts, comments, concerns?
Sure. I have one. What is one of the, what are maybe a couple of the largest resistances around not passing the New York Healthcare Act for All? And yeah, like I can imagine a couple of them, but I just want to hear from you since you've probably studied this.
So the cute answer is white supremacy, because 94% of the state senators who are not in support of the New York Health Act are white. And so like the, you know, essentially the districts that would benefit most from the New York Health Act are generally represented by people who are in support of the New York Health Act. And so, so yeah, so it's, I mean, that's not the most helpful answer, but I think that's probably the most true answer. I think in the arguments you'll hear from the Democratic holdouts, from the Democrats who won't sign on, are, I think, a lot of them are, so the one I've spoken to in person, Diane Savino, who represents Staten Island, she essentially was like, I want to support the New York Health Act. I really believe in universal payer, but there's this issue, you know, I'm worried about waivers about getting money from the federal government going into the trust fund for the New York State. And I'm worried about people who worked in New York and then retired to out of state, like what's going to happen with their health insurance. And I'm worried about this other thing. So at that time in that conversation, I didn't have ready answers for those three issues, though they exist. Which is to say, like, I think the root of why people don't want to sign on is because it's a huge disruption to the status quo, and like the negative political ad will look like Diane Savino voted for a $91 billion tax increase. And like, what's not being said is, well, we used to spend $100 billion on healthcare. So that actually like net is saving us money. But like you know, I think the folks who are withholding it are generally represent purple districts and are worried about those types of campaign ads about how this increases taxes, and the general scaremongering arguments that folks use against single payer. So I'll just like, one of them is, if we go to single payer, you know, won't that increase wait times? No, it won't. Only 5% of New Yorkers are uninsured. We don't expect there to be a huge influx of people. We don't expect there to be a huge influx of people receiving services after this passes. We just expect people will receive the services they need in a more timely manner instead of like delaying it and putting it off until it's a true emergency. And, you know, and even if like in the areas where it would increase wait times, what that tells us is that currently people are not getting appropriate care. So if you know, and the way to solve not everybody not having access to appropriate care is to not by limiting other people's access to appropriate care, it's by making sure we finance establishing care that would be appropriate for all. So like, So I'm both like, that's something people say, and when you hear people say that, please respond immediately with like, oh, so you think because you have a better job you should receive health care before people who are sicker than you? Because that's essentially the argument you make when you say like, if we give everybody health care, it will increase wait times. The only people who are going in front of you in the ER are people who are sicker than you. So like, either your ER doesn't have the resources to handle the day-to-day patient load that it has, and so the right response to that is to invest in the ER so it does have the capacity to take care of everybody in a timely manner. Or you went to the ER on a really busy day and everybody ahead of you is sicker and you just have to deal with it. Like, those are really, when it comes to wait times, like, the way you don't handle wait times is by making sicker people forego health care so you can get it faster. That's, you know, I think most people have heard that argument somewhere on the news and like say, oh, that's a good one, I'm going to say that single payer increases wait times, and they don't think through just how like sociopathic it is to think like to declare that other people shouldn't get care because you may have to wait longer. But yeah, essentially they're all rooted in that. And then another big argument is just that it will cost more money, and where are we going to get the money to spend to pay for all of this? And the answer is through taxes. We tax the rich. There's over 100 billionaires in New York State and over 44,000 multimillionaires in New York State. So like, we could tax all of those, like just those 44,000 people, and get all the money we need to run a perfectly functioning healthcare system. And those people would still be rich. Like, you know, without, they're multimillionaires. If we take $1 million from all of them, they still have at least $1 million left over. So, so yeah, those are like the general opposition and the responses to them in a bow.
Thanks, that's very helpful.
I think also like just a lot of these legislators have, you know, if they get a call on the New York Health Act every other week, you know, it's not worth taking a huge political risk unless you know that this is what your constituents want and are demanding of you. And a lot of people don't know that the New York Health Act is out there and so close to being passed. So the more relational organizing that we can do, and by that I essentially mean like, if you're talking to a New Yorker who's over the age of 18 asking, did you know we're close to passing, like, did you know the New York Health Act exists and we're close to passing it? Like, do you know we're one vote away or close to having universal guaranteed health care in the state? And like, the more people we have from Central Brooklyn calling Simcha Felder, from Staten Island calling Diane Savino, from Long Island calling their representatives, like, if this is, you know, the DSA, the Democratic Socialists of America, have successfully primaried several sitting legislators from the left. So like, if we show there's energy in your district to primary you from the left, if you don't move on these issues, I think it's very likely we'll get them, you know, we'll convince them on our side, particularly folks like Diane Savino, who, you know, ostensibly, who like to put themselves forward as in support of all of these principles generally. I think like the switch will be constituent pressure. Well, guys, thank you so, any other questions while we're here? Guys, thank you so much for joining tonight. Please, please fill out the When is Good. I'm gonna try and get the, try and send an email on Saturday that says like you know, probably 2 or 3 different times next week that folks can tune into. If none of those times end up working for you, just let me know, because like, I really want to do everything I can to include anybody who wants to be included in this process. So I'm happy to work with you. And then kind of in between now and then, tell your friends, have them sign up and get read the bill, mark it up, and come with your thoughts and ideas. And I'd love to really beef up those 10 recommendations. Add some more if we see some cool opportunities to improve it, and get it to a place where we can start asking folks to sign off on it, not next week, but the week after that. Cool. Thank you guys so much. Hope you have a great night.
Thank you.
Thank you so much.